Diabetes is a chronic medical condition characterized by high levels of sugar, glucose, in the blood. Glucose is the primary source of energy for the body's cells, and insulin is a hormone produced by the pancreas that helps glucose enter the cells to be used for energy. In people with diabetes, either the body does not produce enough insulin, or the cells in the body become resistant to insulin's effects, leading to high blood sugar levels. There are several types of diabetes, including type 1 diabetes, type 2 diabetes, and gestational diabetes. Type 1 diabetes is an autoimmune disease in which the immune system attacks and destroys the cells in the pancreas that produce insulin, resulting in a complete absence of insulin production. Type 2 diabetes is a condition in which the body becomes resistant to insulin, and the pancreas may eventually lose its ability to produce enough insulin. Gestational diabetes occurs during pregnancy and typically resolves after delivery, although it increases the risk of developing type 2 diabetes later in life. Diabetes can lead to a range of health problems, including nerve damage, kidney damage, vision loss, and an increased risk of heart disease and stroke. Management of diabetes typically involves lifestyle modifications such as healthy eating and regular exercise, medication, such as insulin or oral glucose-lowering medications, and monitoring blood sugar levels. What are the causes for diabetes? The causes of diabetes depend on the type of diabetes. Type 1 diabetes. The exact cause of type 1 diabetes is unknown, but it is believed to be an autoimmune disorder in which the immune system attacks and destroys the insulin-producing cells in the pancreas. Some genetic and environmental factors may also play a role in the development of type 1 diabetes. Type 2 diabetes. Type 2 diabetes is caused by a combination of genetic and lifestyle factors. Obesity, physical inactivity, and a diet high in sugar and saturated fats can increase the risk of developing type 2 diabetes. Some ethnic groups, such as African Americans, Hispanics, and Native Americans, are also at a higher risk for developing type 2 diabetes. Gestational diabetes. Gestational diabetes is caused by hormonal changes during pregnancy that make the body less able to use insulin. Women who are overweight or obese, have a family history of diabetes, or have had gestational diabetes in a previous pregnancy are at a higher risk for developing gestational diabetes. Other risk factors for diabetes include a family history of diabetes, high blood pressure, high cholesterol, and polycystic ovary syndrome, PCOS. How to prevent diabetes? There are several steps you can take to prevent or reduce your risk of developing diabetes. Maintain a healthy weight. Being overweight or obese is one of the main risk factors for type 2 diabetes. Losing weight, even a small amount, can significantly reduce your risk. Exercise regularly. Regular physical activity can help lower your blood sugar levels, improve insulin sensitivity, and reduce your risk of developing type 2 diabetes. Eat a healthy diet. A healthy diet rich in whole grains, fruits, vegetables, lean proteins, and healthy fats can help prevent diabetes. Avoid foods high in sugar, saturated and trans fats, and processed foods. Don't smoke. Smoking increases your risk of developing many health problems, including diabetes. Limit alcohol intake. Excessive alcohol consumption can lead to weight gain and increase your risk of developing type 2 diabetes. Get regular checkups. Regular checkups can help detect prediabetes, a condition in which blood sugar levels are higher than normal but not high enough to be diagnosed as diabetes. Early detection and treatment can help prevent the progression to diabetes. Know your family history. If you have a family history of diabetes, you may be at a higher risk of developing the condition. Discuss your risk with your healthcare provider and take steps to prevent diabetes. Please suggest some more tips to prevent diabetes. Get enough sleep. Sleep plays an important role in regulating blood sugar levels and insulin sensitivity. Aim for 7 to 8 hours of sleep per night. Reduce stress. Chronic stress can raise blood sugar levels and increase the risk of developing diabetes. Find ways to manage stress, such as meditation, yoga, or deep breathing exercises. Stay hydrated. Drinking plenty of water can help reduce the risk of developing diabetes by flushing out toxins and reducing the risk of dehydration. Avoid sugary drinks. Sugary drinks such as soda, sports drinks, and fruit juices can raise blood sugar levels and increase the risk of developing diabetes. Choose healthy fats. Unsaturated fats, such as those found in nuts, seeds, avocados, and fish, can help reduce the risk of developing diabetes. Avoid saturated and trans fats found in fried foods, processed foods, and fatty meats. Monitor your blood sugar levels. If you are at high risk for diabetes, your healthcare provider may recommend monitoring your blood sugar levels regularly. This can help detect any changes early and prevent the progression to diabetes. Take medications as prescribed. If you have diabetes, taking medications as prescribed by your healthcare provider can help manage blood sugar levels and prevent complications. What are the best treatments available for diabetes? The treatment of diabetes depends on the type and severity of the condition. Here are some of the common treatments for diabetes. Lifestyle modifications. This includes making healthy changes to your diet, exercising regularly, and losing weight if necessary. These lifestyle changes can help manage blood sugar levels and prevent the progression of type 2 diabetes. Medications. There are several medications available for the treatment of diabetes, including oral glucose-lowering medications, injectable medications, and insulin. These medications work to lower blood sugar levels and help manage the symptoms of diabetes. Blood sugar monitoring. Regular monitoring of blood sugar levels can help people with diabetes manage their condition and make adjustments to their treatment plan as needed. Insulin pumps. Insulin pumps are small devices that deliver insulin continuously throughout the day. They are typically used by people with type 1 diabetes or people with type 2 diabetes who require insulin therapy. Bariatric surgery. For people with severe obesity and type 2 diabetes, bariatric surgery may be an option. This surgery can help with weight loss and can improve blood sugar control in some cases. It's important to work closely with your healthcare provider to determine the best treatment plan for your individual needs.